Welcome to That's Gotta Hurt Live. Wherever you're watching, hope you're making this entire week your masterpiece. My name's Dr. David Geier, orthopedic surgeon, sports medicine specialist, and media medical expert. Whether you bet on sports, whether you play fantasy sports, or you're just a diehard sports fan, I help you understand the injury of pro and college athletes so you can hopefully win your bets, win your fantasy league, or just have more fun watching sports. Very excited to be with you tonight. Jamie, I hope you're having a good night as well. Not looking forward to this big storm. I actually just heard about that like literally 10 minutes ago. I am really bad about not paying attention to the weather other than just looking outside and seeing what it looks like, maybe seeing how cold or warm it is. And that's really surprising in a city like Charleston, South Carolina, where the threat of hurricanes is real very frequently. But I did just see there's a major snowstorm coming to a lot of the country, so I hope that is not affecting you too bad wherever you are, Jamie and everybody else. We have a lot of interesting stuff to get to. As I always say, I'm not involved with any of the injuries we're going to talk about. Trae Young, Draymond Green, James Harden, Tyler Higbee, and some others. I am just analyzing information that is out there in the media. 2, I don't answer tons of medical questions on this show because I do more on a Friday show I do called Ask Dr. Geier Live, which is part of Better Than Ever Live, but sometimes I do. If I do answer some of those questions, please understand I'm not giving you medical advice. This is meant for general information and educational purposes only. That's right, I do remember you said Michigan one other time that you were here. Michigan, yes, it's pretty cold. I have an assistant that helps me with all my social media and these live shows and lots of other things I do that is in South Dakota, and she was telling me how cold it has been getting there recently. 113, I may have missed your name. Oh, here we go. Family doctor, 2 years sports medicine. Can I treat sports injury? That's actually an interesting topic that does apply to athletes. So 113, I'm going to get to that at the end of the show. I promise I will answer that about med school, and then do you do orthopedic surgery versus family medicine, primary care, because there are some ways to do sports medicine either way. But let's get to what most people are interested in, which is pro and college athletes. Only one real NFL injury to talk about heading into the Super Bowl. We talked about CJ Uzomah last night, the tight end for the Cincinnati Bengals, and his MCL injury. Well, interestingly enough, Tyler Higbee, the tight end of the Los Angeles Rams, played 14 snaps in the NFC Championship game against the 49ers, went down with a knee injury, was ruled out of the game in the third quarter. Turns out, according to head coach Sean McVay, he has an MCL injury. Now, let me read what Sean McVay said, because I think this is interesting. We talked a lot about MCL injuries last night. We talked about trying to get somebody back and doing a treatment called PRP, potentially platelet-rich plasma, to try to get somebody back in 2 weeks, which is tough with some MCL injuries, like Hines Ward did in the 2009 Super Bowl, which Andrew Kramer put PRP on the map by announcing it at the very beginning, right before they kicked off in that Super Bowl. Anyway, Sean McVay said, we're working through some different avenues. He got an MCL sprain, such a tough guy. We're going to do everything in our power to try to get this guy back and ready to go, but we're working some things. They are working platelet-rich plasma or some biologic treatment to get that MCL, that medial collateral ligament on the inside or the side closest to the midline of your body, to try to get that to heal. But what I didn't talk about last night, so if you want to get into much more of the Hines Ward injury and the history of platelet-rich plasma and what PRP is trying to get that to do, which is getting that tendon and ligament, or ligament in this case, to get that to heal faster, go back and watch last night's That's Gotta Hurt Live. But what I didn't talk about is the reason you don't want to rush somebody back with an MCL is if this medial collateral ligament is not completely healed and you go to plant your foot and change directions, very often you're going to have an unstable knee. You're going to potentially tear that MCL further, but worse, damage the ligaments inside your knee, namely your ACL, or maybe tear the meniscus, the C-shaped shock absorber cartilage. You just can't do that. You've got to get that to heal. There are braces that you can play with an MCL. The offensive linemen, some defensive linemen, if you see the offensive linemen, they all wear those. That's a known thing to try to prevent MCL injuries, and for that purpose, it works very well. But it's a little trickier to play a position like tight end or running back or wide receiver where you have to run and plant your foot and change directions, again, that puts a lot of what we call a valgus stress on your knee, opening up that medial side of the knee or the inside of the knee, so to speak, and that can be very dangerous. So they've got to get that to heal. Now, some are mild injuries, and you are just looking at a week, maybe 2 weeks, but grade 2, grade 3, that's going to be pushing it a little bit. All right, I also want to get into some NBA injuries. Just real quickly, a number of different things. Trae Young missed last night's game with a shoulder contusion. Now, that may not be a big deal. He collided with another player, no big deal. Just could be a bruise of his shoulder joint. This is a right shoulder, if I'm holding this correctly. But what you have to watch for when you hear shoulder contusions, especially if it's some sort of contact injury, is an injury of this, see if I can show you this and not block the camera, this AC joint. Let me point at it this way. This is the collarbone. This is the tip of your shoulder blade here, ball socket. This is the acromion clavicle, acromioclavicular joint, AC joint. If you remember back, we don't use this term much anymore, but you used to hear the term shoulder separation. That is an injury of this AC joint where these ligaments, either the ligaments across the between the acromion and clavicle or between the tip of your acromion and the coracoid process of your scapula, you can either get some horizontal or worse vertical instability of that joint. Usually if it's a mild sprain, not a big deal, and that's what it sounds like in Trae Young's case, but you can actually tear those ligaments, have that AC joint be unstable, and you're talking about weeks or longer. So this will be one to watch, but I expect that this will be a fairly mild thing. All right, a couple updates. A main update on Draymond Green. And this comes as part of an announcement I saw earlier today that more than half of the Golden State Warriors roster will miss tonight's game. They're playing a back-to-back. They've got some older players, so that's not all that surprising. But Steph Curry's going to miss it with toe soreness. Andrew Wiggins, left knee sore. All-star Andrew Wiggins. If you're a K-pop fan, you may have helped get him voted as an NBA All-Star. Left knee soreness. Otto Porter Jr., left foot injury management. Nemanja Bjelica, maybe how he says that. Back spasms. James Wiseman hasn't played all season, recovering from a meniscus surgery. Andre Iguodala, left hip injury management. And then Draymond Green. We talked about Draymond Green, had the calf tightness, then it turns out it may be related to his lower back. Now they are saying that things are going well, but they would check him again before the All-Star game. That is, 2-3 weeks away. So this turns into a fairly significant injury. Doesn't necessarily mean that it's going to be a long-term problem, but this is one I would keep an eye on. My guess is he's undergone cortisone shots into the area around the nerve roots in his lower back to try to decrease the inflammation, decrease the pain, decrease the swelling around the nerve, but still can be a really, really tricky problem. So I just would say, and if you're a Golden State fan, certainly keep an eye on this. Maybe be a little worried. I'm not a Golden State fan. I do like Draymond Green, though. He makes me laugh. I'm glad TNT hired him as a commentator. I think that he's going to be great eventually replacing Charles Barkley. But it's one to keep an eye on. I would not feel all that comfortable betting that he's coming back in the near future. All right, James Harden, another really, really crazy thing. So he's missed now a couple games with a hand sprain. And I've got a model, but when you're talking about a hand sprain, and potentially that means a stretch of tendons somewhere in his wrist or hand, that could be anything, and I'll talk about what that means. But I got to read this. This is head coach Steve Nash explaining James Harden's hand sprain, or hand strain, I got that wrong. Quote, clean of the bad stuff, but a strain for sure. He's talking about the MRI. There's stuff on the MRI, so he's feeling the strain. It's been bothering him, but he was like, yeah, it's nothing. Now it's a little more than nothing. He woke up with a marked difference in the hand. Sounds like a coach that probably, one, doesn't know what's going on, and more importantly, doesn't really want to know all the specifics, so he doesn't have to answer any questions about it. I don't necessarily know what that means, but when you're talking about a strain, you're typically talking about tendons. So those could be the tendons that extend the wrist on the back of your hand. Those could be the tendons that pull your wrist down, the tendons that flex your fingers, the tendons that extend your fingers. That could be any number of things. Typically, that's just a stretch. In basketball, the ball pulls your hand, pulls a finger a certain way, pulls your fingers back. Usually not a big deal, nothing to worry about. And there was a report just a little while ago that says that James Harden has been upgraded to probable for tonight's game against the Phoenix Suns. Best team in the league, with Brooklyn being one of the better teams in the East. That's certainly a good thing. Here's why I think that is interesting, that he is listed as probable. I get questions a lot from people that want to know, what does it mean on the injury report that somebody's probable? What does it mean if they're questionable? What does it mean if they're doubtful? And I followed this one as an orthopedic surgeon that follows sports injuries, and then you've heard me talk about it being a Memphis Grizzlies fan. I follow that because I see the injury report every day because I care about my Grizzlies and I'm always curious. And I've learned to sort of figure out their code. When somebody is doubtful, they almost never play. When they're questionable with the Grizzlies, they're pretty likely to play until recently when the COVID, the health and safety protocols, the Grizzlies put somebody on questionable when they've cleared protocols, but then they have to get their conditioning up, so a lot of those don't end up playing the next game. Questionable for any other reason almost always means they play. Doubtful, pretty unlikely. Well, the reason I bring this up is Kevin Pelton, who's a great writer for ESPN. I really recommend people check his stuff out. But he did a study looking, and I don't know over how long of a period of time this is. Well, I'm all of a sudden not able to pull it up. But I think I remember the numbers. He looked at, I can't find it. He looked at over recent years, all the teams' injury reports, and then how likely they were to play, whether they were listed as probable, they were listed as questionable, or they were listed as doubtful. Now, this matters because in the NFL, they used to dictate it. Probable meant 75% chance or greater that you were going to play, questionable about 50-50, and doubtful 25% or less. They got rid of those sort of arbitrary things. I think they got rid of probable too, just as a category. But the NBA's never had that kind of distinction. Now, we assume that those are kind of the rules. Probable, you're pretty likely to play. Questionable, maybe, maybe not. Doubtful, you're probably not going to play. Well, he did the numbers, and this is what you could look into it generally for athletes that are on an injury report. Probable, players listed as probable on a team's injury report in the NBA played, I think, and again, I can't pull it up all of a sudden, but it was 92% of the time. So much, very, very likely to play. Questionable was just over 50-50, 53%, and doubtful was about 9%, so very unlikely to play. So a little bit more spaced out than the 75-50, 25%. I will tell you, like with the Grizzlies, teams within themselves kind of have their own measurement, so it may not follow that exactly. Like I said, anecdotally, and I haven't done the math, but just over the last couple of years following the Grizzlies, it seems to be a lot higher when their players are listed as questionable, and they almost never list somebody as probable. They just don't list them as that. Questionable, to me, is they're probable. So if you're going to be a betting person, yes, you know the numbers, but then, or you're just a fan of a team, get used to reading their injury reports and then whether those guys play, and you'll pretty quickly get a sense of how likely that is. That's going to be, it's the same head athletic trainer and the same team doctor, orthopedic surgeon making those calls, putting them in those distinctions and filling out the injury reports, and they tend to have patterns and they have comfort levels with different injuries and where players are. So that just generally is what that means. It's probably a little more complicated than it needs to be, but all things considered, I feel like it's completely reasonable. All right, Robert, good to see you. The 113, you're my role model. That kind of scares me a little bit. Noof says, hello, I hope you're doing well. Let me get to Cortisone. Jamie says, cortisone shots got in each of my shoulders. Why does it burn for 24 hours? Cortisone burns. It's just the nature of that medicine. It really, wherever you put it, sometimes it's not 24 hours, but it's kind of the nature of it. I don't really know. I will tell you that people say the same thing about platelet-rich plasma, PRP injections like we talked about with MCLs. But anything into a joint, unfortunately, is going to have a little bit of that. For what it's worth. Now, usually it goes away pretty quickly. I have not heard that many people complain about that with injections into the back. That's just a bigger procedure generally. All right, I did say that 113, I was going to answer your question about med school, going into sports medicine, wanting to be a team doctor. Do you need to be an orthopedic surgeon, or can you do primary care sports medicine? It's a great question, and obviously the training is very different. If you're doing orthopedic surgery, at least here in the U.S., after med school, you're looking at 5 years of orthopedic surgery, then another year of orthopedic sports medicine as a fellowship. That's what I did. That's a 6-year training after medical school to be essentially, again, double board certified orthopedic surgeon and orthopedic sports medicine specialist. Now, you can go into family medicine, which is 3 years, and then do a 1-year primary care sports medicine fellowship. You can do that after pediatrics, ER, physiatry, physical medicine, and rehab. But yes, family medicine is the most common. Here's where the difference comes in pro and college sports as far as taking care of a team. The head doctors for teams are almost always, in fact, I don't know of one that's not, they are the orthopedic surgeons. They are the ones that see most of the injuries because most injuries in sports are orthopedic in nature. ACLs, shoulder dislocations, broken bones, all of that. So they are almost always the team doctors. But pretty much all pro sports, pretty much all college sports, unless you're getting into small colleges, are going to have primary care sports medicine doctors treating the medical problems. We as orthopedic surgeons generally don't want any part of checking for heart murmurs and heart conditions, and certainly don't have that much to do with concussions, even though we're trained to evaluate concussions just sideline, but we don't follow those in the office and do the neurocognitive testing and what have you. So you have the primary care sports medicine physicians doing the medical things on the sidelines. Now, the thing about primary care sports medicine is in the office, a lot of times they work in orthopedic practices seeing orthopedic injuries. They're just not doing the surgeries. They're almost triage people, sending all the ones that need surgeons to the orthopedic surgeons and then managing the ankle sprains and the muscle injuries and the injuries that don't need surgery. So I don't know that necessarily one is better. It really gets into longer training. It gets into, do you want to do the surgeries or not versus managing medical conditions in athletes. There's no right or wrong answer. One is clearly longer than the other, but I don't know that one is better. I would say it probably is a little easier to work with pro sports teams as an orthopedic surgeon because that's what the teams are looking for. Not so much at the NFL, NBA level because they have a whole battery of doctors. I've talked about this in the NFL. I mean, NFL teams have the home teams, 3 orthopedic surgeons on the sidelines, 2 primary care sports medicine doctors on the sidelines, an anesthesiologist there, a dentist there, a neurosurgeon there, some sort of eye doctor, usually an ophthalmologist, and there may be more than that. Independent neurologist as well. They've got all of those types of physicians there in case any possible thing goes wrong. And that doesn't include the athletic trainers and everybody, chiropractors and everybody else that make up the medical staff. So there's lots of different types of doctors. But when you're talking about maybe a semi-pro, not semi-pro, but pro soccer team that's not like MLS level, tennis tournaments, just pro sports that aren't multi-million-dollar contracts to become the team doctors, they're gonna look for orthopedic surgeons because again, in sports, they're typically orthopedic injuries. That's how it is. But I am a big fan of primary care sports medicine doctors. I think it's great. I sit on the medical aspects of sports committee for the South Carolina Medical Association, and there's a bunch of orthopedic surgeons on it that do sports medicine for teams across the state, but there's a bunch of primary care sports medicine doctors as well. So definitely, you can't go wrong. It's really a matter of how you like to practice medicine and what you like to do in it. Noof says, one of my friends had her shoulder fractured, still not recovered. Yeah, it really depends on where the fracture is. If it's clavicle, that's one thing. If it's this proximal humerus, the ball of the ball and socket joint, so to speak. Those are the two most common. And those are fractures around the shoulder are going to take 6 to 12 weeks, surgery or not. Can be a really, really tricky problem. Jamie says, thank you. I appreciate that. I hope you survive this winter storm. Again, I apologize for not knowing too much about that. But anyway, that is all I got for you. If you're betting on sports tonight, and again, I'm not condoning it, but I'm not discouraging it either, remember the probable, questionable, and doubtful. Just pay attention to your favorite team, and you'll start to figure out what their medical staff likes to use and when they use those terms. A lot to get to. We'll try to be here tomorrow night. I got a lot of things going on this week. Also, Thursday, we are talking about what are we talking about? We're talking about exosomes on Better Than Ever Live. Sort of the newer, latest, greatest thing. Hopefully maybe even replacing stem cells for osteoarthritis. So check that out, noon Eastern time on Thursday on this channel. That is youtube.com/Dr. David Geier. Ring the bell to be notified when we're on live. If you like these discussions of pro and college athlete injuries, tell all your friends, anybody that likes this kind of thing, youtube.com/Dr. David Geier. I am thinking about creating a podcast version of this at some point as well. So if you can't make it live, you can listen to it a little bit later wherever you are. So anyway, that's what we have for tonight. I am really, really appreciative that you were here. I will see you